What if I told you there's a natural root that's been used for centuries to fight pain and inflammation? So much so that some call it nature's ibuprofen. Whether you're struggling with arthritis, nagging back pain, or you're a guy who works out and wants faster recovery without relying on NSAIDs, this herbal remedy might just surprise you. It's called Devil's Claw. Today, I'm going to walk you through what it is, how it works, what the science says, and of course the risks you need to know before trying it. So let's dive in. A scary name, but a healing root. Devil's Claw is a plant native to southern Africa. It gets its name from the odd claw-like hooks on its fruit. But the part used in medicine is the root tuber. For centuries, traditional healers have used devil's claw for arthritis, back pain, fever, and digestive issues. Today, you'll mostly see it marketed as a natural anti-inflammatory and pain reliever, especially for joint pain and osteoarthritis. So, is it really effective, or just another herbal myth? Let's look at what the research shows. Can this root really calm your pain? Most of devil's claw's benefits come from compounds called iridoid glycosides, particularly Harpagophytum. These appear to have anti-inflammatory and analgesic effects. Here's what the studies suggest. Several clinical studies show devil's claw can reduce pain and improve mobility in people with osteoarthritis, particularly in the knee and hip. Some patients even reported fewer flare-ups compared to NSAIDs. Low back pain is one of the strongest areas of research. Devil's Claw has been shown to relieve chronic back pain in certain studies, with fewer side effects than prescription painkillers. General anti-inflammatory support. Its compounds work in a similar way to NSAIDs, helping reduce inflammation markers. Digestive support. Traditionally, it's been used for upset stomach and loss of appetite, though modern evidence here is limited. The bottom line, for many people, Devil's Claw seems to offer real, measurable pain relief, especially for chronic joint or back issues. If you're gonna try it, do it right. Most studies use Devil's Claw in capsule or extract form, standardized to contain a certain amount of Harpagophytum. Typical dosage is 600 to 1200 milligrams per day of standardized extract, often split into 2 to 3 doses. Devil's Claw is available in capsules, tablets, tinctures, and even teas, though teas are less concentrated. Devil's Claw is best absorbed when taken with food, and effects build over several weeks, not usually instant like ibuprofen. Here's a pro tip. Look for products that are third-party tested to ensure purity and accurate dosing. Not all herbal supplements are created equal, and quality matters a lot with Devil's Claw. Natural doesn't mean risk-free. While Devil's Claw is generally well tolerated, there are some important cautions. Stomach upset or diarrhea can occur in sensitive individuals. Devil's Claw may increase bleeding risk, especially if you're on anticoagulants like warfarin. It may enhance the effect of diabetes medications, so watch out for low blood sugar. Some reports suggest it can affect blood pressure or heart rhythm, though evidence here is limited. Pregnancy and breastfeeding. It's not recommended in these patients, as safety hasn't been established. So while it's natural, it's not a free pass. Always check with your healthcare provider, especially if you're on meds or have chronic conditions. So who's the ideal candidate for Devil's Claw? You might consider Devil's Claw if you're struggling with osteoarthritis or chronic joint stiffness, dealing with chronic low back pain, looking for a plant-based alternative to NSAIDs with fewer side effects, or someone who works out regularly and deals with sore joints, inflammation, or recovery challenges. Athletes and active men over 40 often turn to devil's claw as a natural way to manage exercise-related aches and pains, especially when they want to avoid frequent NSAID use that can affect stomach or kidneys. While it's not a muscle builder, it may help you stay consistent in the gym by keeping discomfort under control. But again, think of it as a support tool, not a miracle cure. Pair it with a healthy diet, exercise, and weight management for best results, and always discuss it with your provider if you're on other medications. So, is devil's claw a myth or a miracle? I'd say it falls right in the middle. For many people, it offers real relief from pain and inflammation, especially for arthritis, back issues, or workout-related soreness. But it's not risk-free, and it's not a replacement for good lifestyle habits. If you're over 40 and trying to stay active in the gym, or simply want to keep moving without constant pain, this may be a natural option worth exploring with your healthcare provider. Now, I'd love to hear from you. Have you ever tried Devil's Claw? Did it help with your pain or recovery? Share your experiences in the comments. I read every single one. And if you want to learn more about other natural remedies for joint and muscle health, check out the video on your screen right now. I'm Pharmacist Michael. Be happy, be healthy, and I'll see you in the next one.